All right, let's kick things off with a number that should, honestly, stop every single one of us clinicians right in our tracks: 40 to 80%. I mean, what could that possibly be? Well, it's a number that points to a huge and, frankly, a really dangerous problem in how we communicate in healthcare.
Yep, that's it. That's the staggering amount of critical medical info our patients forget pretty much the second they leave the office. And what's even scarier, a lot of what they remember incorrectly. This isn't just some frustrating number on a chart. No way. It's a massive communication gap that directly impacts patient safety and, their actual health.
So the big question is, how do we fix this? How do we actually bridge that gap? Well, that's exactly what we're going to talk about today. We're going to dive deep into a specific AI technique called power prompting. It's all about helping us, as doctors, totally master patient education and finally, close that communication loop for good. Let's jump in.
You know what's at the heart of this whole problem? It's the one thing none of us have enough of: time. We all know the gold standard is clear, written instructions, right? I mean, they're proven to work. But let's get real for a second. Creating a custom, easy-to-read handout for every single patient, every single time, with our schedules, it feels less like a best practice and more like a fantasy, something we just can't do.
Okay, but this is where it gets really exciting. Think about it. To manually create a truly good, personalized handout, that can take, 20, maybe 30 minutes? Who has that kind of time? But with an AI-assisted workflow, you're looking at just 2 or 3 minutes. Let that sink in. We're not talking about a tiny improvement here. This is a total game changer for how our clinics run and, honestly, for our ability to just give better care.
So what's the secret sauce here? The key to all this amazing efficiency is something we're calling the Universal Patient Education Prompt. Just think of it like a master blueprint or a recipe. It's a structured framework you can use over and over again to create clear, custom patient handouts, super fast and super consistently, every single time.
And let's be super clear. This is not just about typing something lazy like, write a handout for diabetes, into an AI and hoping for the best. Nope. This is a structured approach. It actually makes you think about the patient's specific situation, their health literacy, and exactly what they need to walk away with. And then, bam, it generates it all in just a few minutes.
So you're probably wondering, what does this blueprint actually look like? Well, it breaks down into 5 key parts. Super simple. First up, the patient profile. Who are we even talking to? Next, the context. What's the specific situation we're dealing with? Then, the format. Do you want a handout, a checklist, maybe an FAQ? After that, the content. What are the non-negotiable things that have to be in there? And finally, the core requirements. This is where you say things like, hey, write this at a 6th grade reading level. See, each step just builds on the last, giving the AI a really powerful and precise command. All right, so theory is one thing, but let's get practical. How does this actually work when you're in the middle of a busy clinic? We're going to look at how this one single prompt can be tweaked for 3 totally different specialties. It's pretty amazing how versatile it is. So let's start in primary care. Imagine you've just diagnosed someone with diabetes. Instead of hitting them with a ton of medical jargon they won't understand, the AI gives you this simple, beautiful analogy. Your body's key to unlock cells for sugar isn't working well. How great is that? It's instantly understandable, it takes the mystery out of it, it removes that feeling of blame, and it just makes this big, scary disease feel a little more manageable from the get-go. Okay, now let's completely switch gears. We're heading to surgery, where clear instructions are, a matter of life and death, right? It's non-negotiable. So for pre-op instructions, you tailor the prompt to spit out a simple checklist. It's got those time-sensitive, crystal-clear instructions, no room for error. When to stop meds, when to stop eating. This is precision communication, and it's powered by AI. And for our last example, let's pop over to pediatrics. Now this is where you see a really subtle but super important shift in tone. The prompt is told to use your child language. Think about how empathetic and reassuring that is for a parent who's already worried sick. And it also nails those critical instructions, like finishing the entire course of antibiotics even if their kid feels better. We all know how often that gets messed up. Okay, so the universal prompt is an amazing place to start, but we can take it even further. Let's look at a more advanced move now, something that lets you get even more customized and really tailor the explanation to the exact person sitting right across from you. Check this out. Let's take heart failure. On one side, for someone with lower health literacy, you get this amazing analogy. It's like a slow sink train. Your heart can't pump fast enough, causing fluid backup. Simple, right? Anyone gets that. But on the other side, say your patient is an engineer or maybe even another nurse, you can get a more technical explanation using terms like reduced ejection fraction and peripheral edema. And here's the magic part. The AI can create both of these from one simple request. You just pick the one that fits your patient. It's incredible.
All right, I need everyone to lean in for this one because this is probably the single most important part of this whole thing. AI is an amazing, powerful assistant, but it is not the clinician. You are. Let me say that again. AI assists your judgment. It never, ever replaces it. The final review, the final sign-off, the responsibility, that is always 100% on you.
So to make that final review easy and foolproof, just use a quick quality control checklist every single time. First, clarity. Is this dead simple to understand? Next, completeness. Did I forget anything important? Then tone. Does this sound right for this patient? And the big one, safety. Are the warning signs, the when to go to the ER stuff, are they front and center? This is your final check before that paper ever touches the patient's hands.
So as we wrap this up, I want to leave you with just one final question. It's a simple gut check for all your patient communication, whether you're using AI or not. It's really the ultimate test for clarity. Before you hand over any instructions, just ask yourself this one thing. Could a sixth grader understand this? If the answer is a confident yes, then you know you've done your job. You've bridged that gap.